Hi everyone. Before we begin, I would like to introduce myself and describe a little bit about what I do in my experience. I have been in the ABA fields for about 3 years now, and I have worked with patients between the ages of 2 to 21. When I first started as a therapist, I first started working with adolescents in severe behavior department, and now I currently work with patients between the ages of 2 to 7. And now that I have shared a little bit about myself, let's get started. This is my presentation on Case Study 1. The client that we are going to talk about today is Camila Lopez. A little bit about Camila is that she is a female and she was born on February 3rd of 2020. She is currently 4 years old and her caregivers' names are Jessica Perez and Jorge Lopez. She was diagnosed with autism. Caregivers have reported that Camila engages in few behaviors. Mr. and Mrs. Lopez have stated that Camila engages in elopement, throwing items out of context, which is a form of property destruction, and uncooperative behavior. Elopement is defined as any instance or attempts of Camila leaving the play area for more than 5 feet without functionally requesting to leave. Instances are separated by 5 seconds. An onset behavior will be Camila starts walking or running in the opposite direction of the technician, and the opposite behavior is Camila stops by command or by herself. An example would be Camila is at the play area and leaves the room without functionally requesting. A non-example would be Camila is at the play area and requests to go. Now, throwing items out of context is defined as Camila throwing non-functional items out of the context, altering the form or shape of that item. Onset is first instance of Camila throwing an item, and the offset is Camila holding the item instead of throwing it or engages in another item or activity. An example would be Camila throws a doll, picks it up, and throws it again. A non-example, Camila throws a ball and keeps playing with it. The last behavior that we're going to talk about is uncooperative behavior. Uncooperative behavior is defined as any instance in which Camila refuses to cooperate to follow an instruction in the form of yelling, which can be vocal utterances above conversational tone without context, flopping on the floor. It can include kicking or no kicking, or vocally refusing, for example, saying no. Uncooperative behavior can also include crying behavior or not, which means tears coming out of their eyes or not, and each instance of uncooperative behavior is counted by each separate occurrence. Onset is Camila fails to cooperate within 10 seconds of a demand being placed, and the opposite is Camila finishes the original instruction or attempts to finish it. An example would be Camila is told to share a toy with her peer and she yells and shakes her head no. A non-example is Camila is playing with the preferred toy and screams out of excitement. Now we're going to talk about the assessment tools that we use to identify the function of the behavior. The first assessment tool is an functional behavior assessment, also known as an FBA. This includes direct observation, caregiver interviews, ABC data collection. The second one is the Vineland-3. It is a standardized measure of adaptive behavior, which is the things that people do to function in their everyday lives. Whereas ability measures focus on what the client can do in a testing situation, the Vineland-3 focuses on what he or she actually do in their daily life. Because it is a norm-based instrument, the client adaptive functioning is compared to that of other his or her age. The third assessment tool is observation and data collection. Continuous observation during different times of the day will be conducted, and this will provide real-time data on the contents of which behaviors occurred by collecting antecedent behavior and consequences data. Once behaviors of concern were identified and assessments were used to collect data and function of the behavior, the results of the assessment showed that 1. Camila's elopement is maintained by escape and access to tangibles. 2. Camila's throwing out of context is maintained by automatic. And 3. Camila's uncooperative behavior is maintained by escape and access to tangibles. Now we're going to talk about the interventions that we will be using to help the behaviors of concern. First, we are going to use function-based interventions, which are, for example, requesting for cessation, requesting for access for a toy, or to engage in the automatic activity. Another example are functional communication training, schedules of reinforcement, and prompting. The second thing that we are going to use is building skill acquisition. This means that the skills Camila has showed some skill deficits in the Violin 3, which were communication and social skills. These skill deficits will definitely be targeted to decrease behaviors by using the VB map, which will help us write goals for her and programs that will help her functionally communicate with others and also increase those social skills with peers, adults, and others as well. The third intervention is shaping. We will be reinforcing approximations to help decrease those behaviors of concerns. Here's a list of tasks that were used during this presentation and during this case study that were from the BACB task list. We are going to talk about a selected few that were used for this case study. The first one is C1, which is describing behaviors of concern. Here we use this task list item on slide 3 when we are talking about the behaviors and when we operationally define them. We use C2 as well for slide 4 when we talked about the assessment tools. C2 is using direct observation and data collection, which aligns with the need for accurate and reliable data for interventions. F9 was also used when when determining the assessment tools as well, which is conducting the FBA and using Violin 3 to relate to assessing behaviors and determining their functions. These assessments were really important assessments when developing effective behavior support plans. Now, F6 and H4 were seen in slide 6, which were assessment findings informing behavior support plans and interventions. F6 and H4 are a little bit different from each other. F6 describes the common functions of the problem behavior, and H4 is when a target behavior is to be decreased, select an acceptable alternative behavior to be and this is all. Thank you so much for watching my presentation.